Welcome, and thank you for joining me today. Fatty liver disease is one of the most common and most overlooked chronic liver conditions worldwide. Many people have it and don't even know it. In this video, we'll explain what fatty liver disease is, why it's often called a silent epidemic, who is at risk, how it's diagnosed, and what you can do, based on the most up-to-date evidence in 2026, to protect your liver and overall health. Fatty liver disease refers to excess fat buildup in the liver. When fat makes up a significant portion of liver tissue, it can disrupt normal liver function. There are two main forms: fatty liver related to metabolic health and fatty liver related to alcohol use. Today, the most rapidly growing form is metabolic fatty liver disease, driven by insulin resistance, obesity, type 2 diabetes, abnormal cholesterol levels, and sedentary lifestyles. This condition is now a leading cause of chronic liver disease and a major reason people progress to advanced liver damage. The reason fatty liver disease is called a silent epidemic is that many people have no symptoms in the early stages. The liver can accumulate fat quietly for years. Some people may notice vague fatigue, low energy, or mild discomfort in the upper right abdomen, but many feel completely normal. Despite the lack of symptoms, inflammation and scarring can still develop over time, eventually leading to more serious liver disease if not addressed. As fatty liver progresses, some individuals develop inflammation in the liver, which can injure liver cells. Over time, repeated injury can lead to fibrosis, which is the buildup of scar tissue. In advanced cases, extensive scarring can result in cirrhosis, a condition in which the liver becomes stiff and less able to perform its vital functions. Cirrhosis increases the risk of liver failure and liver cancer. Importantly, fatty liver disease is now a leading cause of liver-related complications and transplant in many regions. Fatty liver disease is closely linked to metabolic health. People with insulin resistance, type 2 diabetes, prediabetes, central obesity, high triglycerides, and low HDL cholesterol are at higher risk. However, fatty liver can also occur in people who are not overweight. Genetics, diet quality, physical inactivity, sleep disruption, and hormonal factors all play a role in how fat is stored and processed in the liver. Diet plays a central role in the development and management of fatty liver disease. Diets high in refined carbohydrates, sugary beverages, ultra-processed foods, and excess calories promote fat accumulation in the liver. Fructose, commonly found in sweetened drinks and processed foods, is particularly likely to be converted into liver fat. On the other hand, diets rich in whole foods, vegetables, fruits, legumes, whole grains, lean proteins, and healthy fats support liver metabolism and reduce inflammation. Weight loss is one of the most effective ways to reduce liver fat and improve liver health. Even modest weight loss can lead to meaningful reductions in liver fat and inflammation. Gradual, sustained weight loss is more beneficial and safer than rapid, extreme dieting. Improvements in insulin sensitivity and lipid metabolism that accompany weight loss help the liver clear excess fat and repair cellular injury. Physical activity improves liver health independent of weight loss. Regular aerobic exercise and resistance training increase insulin sensitivity, reduce liver fat, and improve overall metabolic health. Exercise also reduces systemic inflammation and supports mitochondrial function, which is important for how liver cells process energy. Consistency matters more than intensity. Even moderate regular movement can lead to meaningful improvements in liver markers over time. Alcohol intake can worsen fatty liver disease and accelerate progression to liver injury. For people with fatty liver, minimizing or avoiding alcohol reduces ongoing liver stress and allows healing processes to occur. Even amounts previously considered moderate may contribute to liver inflammation in individuals with existing fatty liver. Fatty liver disease is often discovered incidentally on imaging studies or blood tests showing mild elevations in liver enzymes. However, normal liver enzyme levels do not rule out fatty liver or even advanced fibrosis. Non-invasive tools are now commonly used to estimate liver fat and scarring, including specialized ultrasound techniques and blood-based scoring systems. These tools help identify people at higher risk who may benefit from closer monitoring or referral for further evaluation. The good news is that fatty liver disease is often reversible, especially in the early stages. Reducing liver fat can decrease inflammation and slow or reverse fibrosis progression. Lifestyle interventions remain the foundation of management. This includes sustainable changes in diet, regular physical activity, improved sleep, and management of metabolic risk factors such as diabetes, high blood pressure, and abnormal cholesterol. Medications may be used to treat associated conditions like diabetes, insulin resistance, and high cholesterol, which indirectly benefit liver health. In selected cases, targeted therapies aimed at metabolic pathways and inflammation may be considered as part of a comprehensive care plan. The approach in 2026 emphasizes personalized treatment based on metabolic profile, fibrosis risk, and overall cardiovascular health. Sleep and circadian rhythm also influence liver metabolism. Poor sleep quality and sleep disorders are associated with worse insulin resistance and greater liver fat accumulation. Improving sleep duration and consistency can support metabolic regulation and reduce inflammatory stress on the liver. Fatty liver disease is not just a liver problem. It is strongly associated with increased risk of cardiovascular disease, kidney disease, and metabolic complications. In fact, cardiovascular disease is a leading cause of illness and death in people with fatty liver disease. This is why managing fatty liver is about protecting overall health, not just the liver. Screening and early identification matter. People with type 2 diabetes, prediabetes, obesity, and metabolic syndrome benefit from evaluation for fatty liver disease, even if they feel well. Early identification allows for intervention before significant scarring develops. If you've been diagnosed with fatty liver disease, small, consistent changes can make a powerful difference. Improving diet quality, increasing physical activity, addressing sleep, reducing alcohol, and managing metabolic health can all work together to support liver recovery. Progress is often gradual, but meaningful improvement is possible. If you found this video helpful, please like, subscribe, and share for more evidence-based health education.